So we're excited to start this new part of our website that will be like a blog post with information and articles. And I'm going to jump right into it with some statistics. Did you know that 70% of people age 55 to 65 in America suffer from a chronic condition? And 50% of those have 2 or more chronic conditions. And when we're told that big C word, chronic, when the doctor says, here's your diagnosis, and it is chronic, it can give a sense of hopelessness. We take that to mean that, for chronic to mean that there's nothing that can be done about this. So you're going to have to live with it. Now that is only partially true. What often we in the medical community mean when we say it is chronic means that there is no known cure for this condition, and that's hard to hear. But by cure, we often refer to medication or surgery. But that doesn't mean that nothing can be done about it. There are often a lot of things that can be done to feel better, to manage the condition better, and to be able to continue to live and adapt to the condition and be able to still do the things that you want to do so that it affects your life as little as possible. That is our passion as occupational therapists. For the last 12 years, we here at Self-Care Therapy has specialized in a specific chronic condition called lymphedema. That's a vascular condition that creates swelling, swollen feet, ankles, hands, arms, for many different reasons. What we have been inspired by working with patients, even though the condition is chronic, we've been able to reduce the symptoms to a bare minimum or none, and then we've worked with our patients to teach them everything we know and everything that research knows about how to manage this condition. Eventually, the self-management of the condition becomes a part of their daily routine. It becomes like brushing your teeth. It's just something that you do, but it's not consuming all your energy and all your time, and you're able to continue to do things in life that you want to do. I believe that these same principles really can apply to many chronic conditions. The most common ones like diabetes, COPD, heart disease, venous insufficiency, arthritis, and the list goes on and on. We believe in learning as much as possible about this condition, learning how you can adapt to this condition, how you can manage it to keep the symptoms as small as possible, and also other things you can do to feel better and do more. That is our passion here. Our mission is to help people adapt to chronic conditions that they suffer with and be able to feel better and do more. But this blog site is not going to be about us. Hopefully it will be about you, in the way that you will be able to find useful information that will help you or a loved one manage whatever challenges you are facing in life. It could sometimes be by having the right equipment so that you can adapt, or it could be to learn about basic things that can make us feel better. Even things like sleeping right, eating right, exercises that we can do, and having the right stuff, having the right equipment can often be the solutions too. So I hope that this blog site will be an inspiration and that it will be a help to whoever comes on here looking for solutions to daily life challenges that are caused by chronic conditions, by aging, and disabilities. My name is Robert Erikstam. I'm an occupational therapist with Self-Care Therapy here in Wilmington, North Carolina. And if you have anything that you would like for us to share on this page, or a story that you would like to share, maybe you've learned a tip on a way to manage a common problem. A lot of the things we've learned over the years have been from our patients, and then we can sort of be a a place to share that information, just like we do in the clinic. We'd love to be able to do that here too. You'll see a lot of information here about lymphedema, since that has been our specialty for the last 12 years, but there will be information and articles here too about many other conditions and challenges.